Join us for the next Tubules Live show on Thursday, 16th February 2017 from 18:30 hours GMT. The topic is dilemmas in the aesthetic zone. Would you extract or save? We have 3 specialists, a prosthodontist, a periodontist and an endodontist, going to discuss the cases. Let's have a look at them. Here's the first case. A 78-year-old male patient who complained of loose upper anterior crowns. He had no pain. Medically, he was on warfarin. He did have a low lip line. He had some gingivitis, but no obvious periodontal disease. He was a high caries risk patient with a class 3 incisor relationship with a positive overbite and a negative overjet. The upper left 3 to the upper right 3 had linked porcelain fused to metal crowns, with majority of them de-cemented or detached from the underlying roots. Failure combination of caries and mechanical fracture. The patient wants a fixed solution. Let's look at the views. Here's the anterior view. Let's look at the occlusal views. Let's look at the close-ups of these anterior crowns. Let's look at the radiographs for this patient. What happens when those crowns came off? That's an occlusal view, showing you the retained roots. Question is, would you extract these and provide an implant-based fixed solution? Or would you try to retain these teeth and provide a teeth-based solution? On our Tubules Live on the 16th of February, Drs. Kavit Shah, Dr. Rajiv Patel and Dr. Daniel Flynn will be discussing this case. What you need to think about is, what is your diagnosis? How would you describe the long-term prognosis of these teeth? What is your treatment plan? Do you save or do you extract these involved teeth? This will be an interesting discussion with 3 specialists. This is just the first of the 3 cases. Let's look at the second one. It's another treatment plan exercise and will be read by Dr. Rajiv Patel, who's a specialist in periodontics. The presenting complaint from this patient, who was referred by the implant dentist, was to advise to see a periodontist prior to any implant treatment. The patient was a 30-year-old male who wanted implants to replace the missing lower right incisor teeth. Both of these teeth had been lost about 1 year prior to presentation due to periodontal causes, and the patient was unhappy with the appearance of the upper right central incisor, which showed some level of over-eruption and labial drift. There was no previous periodontal treatment provided for this patient or no known family history. And on examination, the patient had no gingival display on smiling, so it was a fairly average lip line. And intraorally, there was a class 3 incisor relationship with group function in the left and right lateral excursions, a completely unrestored dentition with localized regions of marginal inflammation. Let's have a look at some photographs. Here's the anterior view. She wants implants for those 2 missing lower right incisors. And what to do with that drifted, over-erupted upper right central incisor? How about some lateral views? Have a look at these. How about some occlusal views? What about this patient's periodontal chart? Seen in July 2013, the plaque score was 24%. The bleeding on probing score was 27%. But look at the depth of the pockets. They range from something like 2 to 3 millimeters all the way to deep pockets of 10, 11, 12 millimeters. Of these, the most significant deep pockets seem to be on the lower right 6, lower right first molar, upper right second molar, and the upper right incisor tooth. So let's look at the radiographs for these. There we go. The lower right first molar appears to have angular vertical bone loss of 80 to 90% on the distal root. That upper right central incisor, which had over-erupted and drifted, appears to have 90% bone loss perhaps. Are these teeth savable, or would you extract them? The questions to ask are, what is your diagnosis? How would you describe the long-term prognosis of these teeth? And what is your treatment plan? Do you save these teeth, or do you extract them? On our Tubules Live on the 16th of February 2017, Dr. Rajiv Patel, together with Dr. Kavit Shah and Dr. Donald Flynn, will be discussing this case, and they will show you how they managed it. Join us for this exciting Tubules Live. 3 cases, we have shown you 2 of them. Let's have a look at the third case. In this case, the dentist referred the patient to the specialist endodontist. He said the root canal treatment for this tooth was done in 1998. I did the cast post just last year, and I carried out crown lengthening and a crown on both central incisor teeth in December 2016. Now the upper left one is tender to percussion, and there is tenderness on palpation of the apical aspect. I suspect a root fracture. Please advise on the best course of treatment. Let's have a look at these teeth. Good, nice looking crowns, healthy gingivae, thick biotype. The periapical radiograph sent by the referring dentist looked like this. You can see the cast post core and crown on the upper left central incisor with the root treatment. It was difficult for the endodontist to take another periapical as he was going to do a small volume CBCT scan. Let's have a look at that scan. You can see that the upper left central incisor has an apical lesion and buccal bone perforated. There is no pathology associated with the upper right central incisor. Would you save this tooth, or would you extract it? What is your diagnosis? How would you describe the long-term prognosis of the 2 central incisor teeth? What is your treatment plan in this case? What would you do? Would you save this tooth? Or would you actually extract this tooth? These are dilemmas of teeth in the aesthetic zone. And the Tubules Live on the 16th of February 2017 will be talking about these dilemmas and actually discussing about the options, treatment and management of such difficult cases. Would you extract or would you save? Join us for an exciting interactive live stream from Drs. Kavit Shah, prosthodontist, Dr. Rajiv Patel, periodontist, and Dr. Donald Flynn, endodontist, to give you a multidisciplinary view of how you approach the treatment planning of such cases. We look forward to seeing you on this day.